Assalamu alaikum and welcome to another program of Health is Wealth. I am your host Shabnam Riaz. We're having a wonderful start to these programs where we're really enjoying what we're doing. We're being able to discuss things that we think will be a help to the people watching, our viewers, in creating awareness about things, many things that have just myths or they're just not taken very seriously, or we just tend to neglect things. It's something that we don't really care about, but we should, because the problem is that then when something becomes a health issue, that's when we run to the doctors, and the usual thing that we hear is that they say, I wish you had come before. So that's something that we want to do with this program. Today's program is about the eye, and how many of us really properly take care of our eyes. I don't think there will be many people who would say yes, that we do. And for today's program, of course, we have expert advice, and we're very happy to have with us right now. First of all, I'd like to introduce Dr. Masud Hassan, consultant eye surgeon. Thank you very much for joining us here today.
And thank you very much for the invitation. It's my pleasure to be here and to give my expert opinion on this subject.
I'm sure viewers will benefit immensely. Also, we have Dr. Tahir Masud, who's a consultant oculoplastic surgeon. I hope I said that right.
Yes, you did.
Okay. Pleasure having you here as well. And we are going to talk to our guests and get their expert advice. But first of all, right now, let's have a look at this report.
Most people have eye problems at one time or another. Some are minor and will go away on their own or are easy to treat at home. Other needs a specialist care. Eye diseases are increasing globally. More than 3 million people are suffering from different kinds of eye diseases in Pakistan. Some of the common eye diseases are eye strain, red eye, night blindness, cross eye, cataract, glaucoma, retinal disorders, and conjunctivitis, commonly known as pink eye. Environmental factors like contaminated water, dust, and smoke are the cause of different allergies and diseases, whereas cousin marriages is ranked as major reason for eye disease among newborns. Fortunately, modern equipment and surgical techniques available today are greatly helpful in treatment of eye diseases. 80% of these diseases can be cured with timely intervention. However, one major obstacle to the provision of eye care to the needy is lack of necessary facilities. Mostly people go to eye specialists after a considerable delay. People above 40 years of age are more prone to diseases associated with high blood pressure and diabetes. Whether your vision is not what it used to be or never was that great, there are things you can do to get your eye health back on track.
Okay, right. So you've seen that report. It's just a tip of an iceberg right now. But to talk in depth about eyes, looking after them, the problems that we may have, we'll now turn to our experts, of course. Dr. Masud, tell us about, the common problems that you see among people who come to see you, the main causes of concern, and the things that people should be looking out for.
The common problems, they do vary with the age. If we talk about in the children's, they do come with the problems of not seeing very well, so they have the problem with the glasses. And then as we go on now, these days most of the patients, they want to get rid of their glasses, and they want to have laser eye treatment. And then if we go more, so above the age of the 50 and 60 years, we do get the problem with the cataracts, which is the lens of the eye, which gets opaque and cloudy with the time, and then it impairs their sight. And then in the age of 70 or 80 years, then there's a problem with the retina, which is called age-related macular degeneration.
Okay,
so
just to interrupt you there, you spoke about laser, many people opting for getting laser done. Is that something that's recommended for all sorts of patients, or do you have a certain criteria of people who fit that sort of surgery?
Yes, it is a very good question you have asked. Yes, there is a protocol, because everyone wants to get rid of their glasses. So the criteria is the one should be at least above 21 years old, because at that time the the growth of the eyeball has stabilized, and then it also depends on what is their prescription, because if someone has very high prescription, then doing the laser means the changing the shape of the cornea, it can be risky.
Oh, I see.
So
Okay.
so we have to see what is the safety
You
safety
sort of
levels.
like weigh the benefit and the
Exactly,
advantage and
yes,
disadvantage
yes,
factor.
yeah,
Okay.
yeah, exactly.
Right.
And then when as you have asked, it is end of the day. It's a cosmetic treatment. So so it is the personal choice, but it has a very good outcome as well.
I see. Okay. So, of course, you counsel the patients, you talk to them, and then you sort of come to a conclusion as to whether they're the best candidate or not. Okay, Dr. Tahir, you're a consultant oculoplastic surgeon. Please tell us what that means.
Okay. So I actually, I've done my training in the UK, and during the last few years while I was there, I specialized in eyelids.
Okay.
So throughout the world now, it is recognized that eye doctors, eye surgeons can work on the plastic side of the eyelids better than general plastic surgeons.
Okay.
So this is a well-recognized subspecialty now. So I deal with all kinds of eyelid problems, both functional as well as cosmetic. So for example, talking about some functional problems, you can have damage to your eyelids due to trauma, due to certain tumors. In the Western world, eyelid tumors are very common, less so in Pakistan.
Is there a sort of a link as to why it's more?
I think people who are more fair-skinned,
Okay.
they get more sun damage.
Okay.
So I think all of us need to protect us from the sun anyway. So wearing sunglasses during this, we have lots of bright weather here, so that always helps because we do have people, especially people in the north, who are very fair-skinned.
Just to interrupt you there, as you were saying about sunglasses, we get a lot of sunglasses that are sort of the ones that look sort of really cheap that you can get from roadside stalls or whatever. Should there be a proper UV filter on sunglasses that a person? How important is that?
I think that's very important because I think the cheaper versions do not actually provide you that necessary protection. So I would recommend you go to a well-recognized optician, optometrist, and get the proper pair of sunglasses.
Right.
So I also deal with something called ptosis, which is droopy eyelid. So some children are born with a very weak levator muscle, the function of which is to lift our eyelids. So during my practice here in Pakistan, I see a lot of children and young adults with that. Some people also get droopy eyelids as they age. So that is a treatable condition. It has functional as well as cosmetic aspects. And I think that's something I would definitely like to highlight. I see young adults in their, say, late teens or early 20s, and they've just kind of accepted that they have to live with this droopy eyelid. And I think it has a very bad effect on their personality. So I've successfully treated a lot of patients with ptosis while I've been in Pakistan. Yes.
And again, that's all about awareness, because there's so many people who just are not, familiar with this this part of eye problems, and they wouldn't even know about it. So that's something else that I would think that our viewers would find very, very helpful.
Sorry to interrupt, I can also add in this that this, the drooping, if it is in the children, so it can impact their eyes, because if they can't see, because the development age of the retina is up till 8 to 9 years of age. So if they have a droopy lid and they can't see through that eye, which means they get the lazy eyes, which means after that time has passed, so they can't see well in the rest of their life. So it has to be addressed.
Of
immediately if we
At the
have
right age.
the droopy eyes, before 8 to 9 years of age. And I think, the Dr. Tahir has seen a lot of cases.
I completely agree. After that age, you can improve the appearance and the cosmesis, but you won't be able to help that child with their vision. So if someone has a very significant droopiness, a child has very significant droopiness, so much so that that eye is not being used, then almost as an emergency, I would like to lift that eyelid so that...
I see that's how important
exactly,
that
it
is
is,
to
it
be
is,
addressed
it
at that
is.
time.
Yes.
Another thing that I'm sure many people would not know, so that's also a very, very important point for you to take home and think about. Dr. Masud, you talked about lazy eyes. What exactly are lazy eyes for?
The lazy eye is a layman term. In the medical term, we call it amblyopia.
Okay.
So, the prevention of amblyopia, it is the main concern in the world now. So, the amblyopia can be due to if a child has a refractive error and it has not been addressed,
Okay.
or if they have, like, we just discussed the droopy eyes or anything in the media, in the in the media of the eye. Suppose if someone have a cataract, if they have opaque lens, or the scar at the front, if it has not been addressed, so that eye, it become lazy, so which means it will not take up its full function, even if you do as much. So it has to be addressed before that time. So what we do to prevent amblyopia, there should be a proper primary screening of the child, especially when they start going to school at the age of 4 years.
4 years.
Yes.
Okay.
So
And now
the
4 years. You're saying 4 years, but the average
Age.
parent won't think that their 4-year-old child needs to go to get their eyes checked. Isn't that
Yeah.
something that we?
It is
Right.
true, but what is happening in the UK and the US, the a primary screening team goes to school and they do primary screening
Right.
in their schools,
Okay.
and to pick up the child, and then they advise them to get their eyes tested. So if someone have a refractive error, so we prescribe them the glasses, and then to correct the amblyopia, we do the patching treatment. I think the Dr. Tahir can explain this more for us.
Yes. So it is really interesting to note how many adults come to us and they have never realized that one of their eyes is weak, because the other eye actually overcompensates.
Okay.
But in an ideal world, we want both eyes to have matching vision, and as Dr. Masud Hassan very rightly said, screening is the key.
Right.
So fortunately, some of the private and government hospitals and some NGOs in Pakistan have started I would say some kind of screening programs at some level, but I think it has to be highlighted more, and the government must participate in this as well. Once we know that a child who's less than 8 years of age, one of his eyes is lazy, is not functioning very well, basically what that means is the brain has somehow ignored that eye,
Okay.
and is relying on the better eye more.
So Dr. Tahir, to
yes.
help our viewers, what are the symptoms?
Symptoms that's very difficult actually. This is the problem. Often the child would not complain. So especially if they have amblyopia due to refractive error, it's often asymmetrical. So one of the eye would be very weak, the other eye actually would be quite good or normal. So often the child would not know unless they actually physically check their eye separately.
Right.
The other causes of amblyopia, obviously, we know is squint. So if one of the eye is misaligned, that eye is not focusing very well.
Right.
If an eye has a cataract, or if the lid is droopy, that eye obviously would not. So they would be able to, they would be picked up much early. But focusing problems, refractive error problems are very difficult unless you actively screen the child, ask him to read from a chart and do some more advanced tests. So Dr. Masud was asking about patching. So that's very important. Once you know that the child's eye is, one of the eyes is weak, we ask the parent to patch the healthy eye, and we kind of force the brain to use the weak eye more. And that has very good results actually. But unless you know that the problem exists, if this is discovered after the age of 8 or in teenage years, then unfortunately even patching won't help.
Oh, I see.
Yeah.
So you see, this is a very, very important part of today's program. What our experts are saying is that the early screening is something that you have to be very aware of. If you are a parent, 4 years old is usually a time when you don't think that you need to take your child to see an eye specialist, but do that because all these things can go along unnoticed, and then of course it makes it harder to get them treated as well.
Yeah, and you know, the one of the sign which we have to look for is if the child is, you know, sitting too close to the telly. It means they can't see well from the distance, so it can give you a clue that this child may have a refractive, you know, problem.
Okay, Dr. Masud, you know, one of the, we have many myths when it comes to talking about eyesight and things like that. I remember my mother always saying to me, you know, don't sit too close to the television, because if you sit too close to the television, you're going to get glasses. And then if I used to read too much, she used to say, don't read too much, because if you read too much, you're going to get glasses.
Get glasses.
What is true and what's false?
Well, when it is true in the sense, if you sit too close to the telly, of course, you know, there are radiations which goes to the retina, and it can cause bit harm to your eyes. But you know, if someone is sitting too close to the telly, it means they can't see the telly well, so they have to come, you know, close. So it means, you know, they might have some problem with their eyes. And you know, the reading too much, well, I mean, I don't know about that side of thing. Have you got any idea?
Yeah, I'd like to add something there.
Yeah.
So research has shown that intensive close work in children actually can cause myopia. And there's some research that's recently come from Australia which has shown that during the last few years, since the advent of the internet and lots of these computer devices, myopia is on the rise. So they're predicting that by the year 2050, half of the world's population may be myopic.
So what does myopic exactly mean
So
for
that
our
actually
viewers?
means that this is a refractive error of focusing in which you require minus lenses. So the image is not being focused onto the retina, slightly behind the retina. So that clearly is linked with close work. So they are recommending that children should kind of go back to the old-fashioned way of outdoor activities and sports, and I think that's definitely something I would recommend. So young children using small devices like iPads or phones unsupervised for hours on end, I don't think is a good idea at all.
So what are your guidelines for parents who are watching? I've seen very, very young children with gadgets in their hands, their games and all sorts of technical things that they're basically addicted to.
Yes.
What should be the guidelines? How young, I mean, how old should a child be before they're exposed to such electronic gadgets, and how much time should they be spending?
I mean, it's a very easy way of kind of calming down your child. Just give them something so that, and there's lots of interesting stuff there. I don't disagree that they have these devices do have an educational value, but my personal feeling is you have to delay that as much as possible. So I see very young children using these devices. I'm, I think, quite against that. So I think teenagers who perhaps need computers for their learning, perhaps that's a better age. And also there are some of the ophthalmologists are recommending that you should not use these devices for more than half an hour. At a stretch. So apart from the problem with the vision, they can also cause dryness of the eyes, certain eyelid conditions like blepharitis, and there's a new term being coined, computer vision syndrome, people getting headaches and lots of things. So
because of the focusing thing.
So I think clearly parents need to supervise how much their children are using these devices.
Of course.
Because you know, what happened that when you use the iPads or the gadgets, you know, your blinking rate get less. Normally, you know, we do blink about 15 times a minute, but when you are, you know, focusing, so that has you know, reduced to about, you know, 7 to 8 per minute. so which cause more the dryness of the surface, because the function of the blinking is to keep the cornea wet. So if you blink less, so then your the surface become dry, and then you end up in the dry eyes.
Right. Dr. Masud, tell us about the impact of diseases like diabetes and blood pressure on eyesight, and what such patients, what sort of how they should manage.
Yeah, the diabetes is it is a major concern, and it does affect the eyes as it does affect any other the organs of the body. So in terms of the eyes, so we do get cataract at an early age, and then it does affect the retina. We do get a condition called diabetic retinopathy, in which we get the bleeding at the back of the eye, and also the leaking of the fluid. And then if it is not addressed well, so it can cause the damage
Long-term
damage to the retina.
Okay.
So what I advise to the patients who are diabetic, so they do get their eyes checked once in a year, especially when it is established that there are the signs of diabetes on their eyes, so they do get their eyes checked at least once a year.
And any precautions they should be taking?
The precautions is the control of the diabetes is very important.
Right.
So their HbA1c level, which is a blood test which shows diabetes control over the last 3 months time, so it should be within the range. So if it is out of the range, so they have to consult their physician for a good diabetes control, either in the form of the diet or the tablets, or in the form of insulin.
Right.
So it should be
something that it
well
should
controlled.
be managed, and they should be on
and
the lookout.
similarly, the blood pressure has also has an effect on the eyes. If the blood pressure shoots up, so it can cause the rupture of the vessels at the back of the eyes, and it can be sometimes very nasty. So the blood pressure and diabetes, it should be well controlled, and if someone have either of these conditions, so they should get you consult with their eye doctor once a year, and also a regular checkup with their physician.
Right. That's also very, very good advice. So for anybody who is a diabetic, you have or has blood pressure, you must be very careful about managing your disease, and also be in touch with your eye doctor as well. Dr. Tahir, please tell us about the use, the common use of contact lenses. Nowadays you'll see, somebody's using it for eyesight, or they're using it for cosmetic purposes as well, the coloured ones as well. How should we take extra care? When is the time to be alarmed, and how should we generally approach them?
Okay. I think you've touched something very important. I do see a lot of young people who wear contact lenses, and a lot of patients having problems as a result of that. So basically, contact lenses aren't for everyone.
Okay.
Some young children are able to handle contact lenses very well. The trend worldwide is to use contact lenses that would not require very frequent cleaning. So there are some daily wears that you just put them on for that day, and you just get rid of them at the end of the day.
Okay.
So all studies have shown that if you sleep with your contact lenses on, you're bound to get dry eye, and there's increased risk of infection as a result of it.
Right, so that's a big no-no.
Yes.
Yeah.
So the trend of having contact lenses that you keep for a whole year, I don't think that's practical anymore.
Okay.
It's very difficult to actually keep them clean for such a long time.
Okay.
Nowadays, there are these monthly and bi-monthly ones that are also available. So I think that is a reasonable compromise. The daily wears are not; they are quite expensive in Pakistan. So I would recommend that young people who are interested, they should get their vision checked by a trained optometrist or an ophthalmologist. They should have their eye checked, because if you have dry eyes or something called blepharitis, which is this condition of your eyelids where you're not producing enough oil in the tarsal glands. So that actually can lead to more problems with contact lenses. So there is a preliminary check that would be done by a trained professional. There are some corneal measurements that are often also done. And if you have the approval of a healthcare professional, then you can proceed to contact lenses. And also, again, it's a trial thing, so not everyone feels comfortable actually placing something on top of their cornea. For some people, it comes very naturally, they have no problems. But the key thing is to maintain I think hygiene and keeping things clean. That's the main thing. Corneal infections can be devastating, and they can be vision threatening.
Very nasty,
they can be vision threatening. So never take this lightly. If your eye becomes red as a result, contact your eye specialist at once.
Do
not put them back in. So that's the key thing. The other thing I've noticed that the cosmetic type of the colored contact lenses, they're often of very poor make. So they can give you more problems. They can give you more problems. So I think that the key lesson is, if you're a contact lens wearer and your eye becomes red and sore, you must take them out and you must consult an eye specialist.
And
that's very valuable advice.
Also, you know what I add to keep these, the lenses safe, to bring with yourself to the doctor, so that if there is an infection in the eye, so we can send that lens as well to the laboratory, for the culture and sensitivity, to find out which organism has caused the infection in the eyes, so that we can start the antibiotic accordingly to get the best outcome.
Right. Okay. General eye care. What should that be? Sort of, something that a couple of
healthy
tips.
diet. Healthy diet is also very important, especially when you're getting older. Like eating, carrots and
is it true then
leafy
carrots
vegetables?
We'll be able to
Yes,
see in the night? It is.
It is true, because it contains essential nutrients which are good to keep the function of the retina
well. Is
well.
it the same if you're eating raw carrots and cooked carrots? Is it?
It is the same. Yes,
Okay.
I mean, it is the same. But if you cook the carrots in more, oil, so of course that side of the thing, then oil, so it can increase, the cholesterol level. So, but if it is, the vegetables, especially the green ones, the carrots, and healthy diet, and the fruit, one portion of a fruit per day, that is good to keep the function of the retina well. So, and then the general care, as we have discussed, we should wash our hands, we should clean our eyes at least once a day, like we clean our teeth once or twice a day. So if someone have that condition which Dr. Tahir mentioned, blepharitis, so we should make a habit of cleaning the eyes. So how we do it, it is just a warm boiled water, and then adding a Johnson's baby shampoo in it, a small portion of the shampoo, because it does not contain preservatives, so it is safe to your eyes. And then with the help of a cotton bud, we should clean inside of the lashes at least once a day. So that side of thing, healthy diet, and if someone have any concern with their eyes, so
they must see it.
They should seek an opinion.
Of course, of course. Dr. Tahir, we don't have much time, so just briefly, could you tell us the effects of makeup? On eyes, and how you can.
I was wanting to speak on that actually. Dr. Masud mentioned about blepharitis. So I do see a lot of young women who have blepharitis as a result of eye cosmetics. So the general advice would be that make sure you use cosmetics of a good brand. Make sure they're not expired. And if you feel that a certain product is irritating your eyes, it's best to actually stop that and get expert medical advice. Often if someone has very dry eye and bad blepharitis, so in blepharitis actually you get crusty eyelashes and your glands are not functioning well. So in such cases I often ask them to be very gentle with the cosmetics. and it often does help. One of the things I would like to add about the eye care Dr. Masud was mentioning, warm compresses to your eyelid actually help a lot. So before going to bed, if you take some clean cloth or a towel, and then there's some special purpose-built eye pads as well, which can be, for example, heated in the microwave. If you close your eyes and apply that warm compress, that heat opens up these oil-producing glands, and they start functioning better naturally.
This is something at night that you're saying? Something
Yes,
to be done at night?
I think all of us have busy daytime, so I think this is something, if you make a bedtime habit, that
because
obviously
you always
helps.
see sort of like people with cold tea bags on their eyes as well. Does that work?
Yes, I
No?
think all these things do help to some
Okay, they
extent.
do. Okay,
but warm compress is something that
Great.
is advised
Properly
throughout
made
in the Western world.
Fabulous.
It is a well-documented way of treating your
That
eyes.
is excellent advice. So, I hope you all of you are just taking notes and, remembering all these things. Because if you think at the end of the day, when you're so tired, and if you have something soothing on your eyes, it would be a wonderful way to fall asleep as well. As usual, we've run out of time, and there's so many things to talk about. But
that's
we,
right.
we'll try and have another program on this issue as well. Dr. Masud Al-Hassan, thank you so much for joining us.
Thank you.
Dr. Tahir Masud, thank you both of you. It's
Thank you very
pleasure.
much.
we've
Thank
really,
you.
really enjoyed talking to you,
Thank you
and
so
it's been great getting all this advice from the experts. Thank you so much.
Thank you very much. Thank you.
Okay, so now we're going to move on to our next segment, and that is emotional well-being. Okay, and now we're on to our next segment, which is the emotional well-being segment that we promised we would bring to you in each episode, and here we are again. For today's emotional well-being segment, we've come up with a topic that will involve everybody, I think. The impact of social media on our mental health, and to talk about that, we have in our studios Dr. Najma Aziz, who's a psychiatrist. Thank you very much for joining us here. And right now, let's have a look at this report and then see what we find about the impacts of social media on mental health and the disconnect anxiety as well.
Internet is a wonderful thing. It was designed for the free exchange of information across borders and without boundaries. It has changed life to the better by spreading knowledge, fostering creativity, and encouraging connectivity. Social media is the driver behind that connection, helping put us back in touch with old friends and maintain relationship with loved ones on the other side of the world or just down the road. It is about sharing and broadcasting your life online, conversing with friends and strangers, but crucially in an always on and always connected manner. Mark Zuckerberg's vision for Facebook centers around making the world more open and connected. While the ambition to get everyone in the world online is admirable, it is also suffused with problems. Twitter users tweet 400 million times a day, while Facebook processes over 500 terabytes of new data every single day. It is an unfiltered, harsh world full of tastefully Instagram photos, well-crafted status updates, and spoilers to your favorite TV shows. Internet has made connections so easy that it is taken for granted. And yet we are addicted to these platforms. A problem that the proliferation of smartphones has worsened. On average, we check our smartphone 150 times a day, with around 50% of us updating our statuses or posting content while we are on the move. And herein lies the crux of the issue. We are used to constant connectivity, so being deprived of it is causing what is referred to as disconnect anxiety, with people experiencing negative emotional feelings when they are unable to get online. The internet has in effect become such an ingrained and important part of our everyday life that it is having a very tangible detrimental effect on our well-being. Recent psychological research revealed that connection via social media, in this case Facebook, can also have adverse effect on our levels of happiness. What we are seeing here is a consequence of the performative nature of social networks. Profile often portrayed an idealized, highly considered version of one's true self, which can engender feelings of inadequacy amongst those looking on. A friend's life highlights and milestones might seem a long way off to many, which can make them feel as if they are missing out or being left behind. In this respect, social networks as an uncomfortable mirror against which we unconsciously measure ourselves and determine our own sense of worth. They are also a reminder of the benefits of true social interactions, like meeting up with someone and talking to them.
Okay, so that was actually a very informative report about the impacts of social media, where you have the good and the bad with everything. There's definitely things that are therefore concern. So, Dr. Najma, if we could, come to you now. The element of social media in our lives, has it become something that is actually taking over us, taking over our relationships, taking over the way we actually want to portray ourselves in some sort of false identity?
Bismillah ar-Rahman ar-Rahim. I agree with what has been read in the report and what you are pointing towards. Social media is a relatively new phenomenon, but it has blown up tremendously in the last decade. And it has taken over the world, although it has brought the world together, closer, but it has got certain impacts on the general health of the society. And by this I mean the mental health.
Yes.
A lot of studies have been carried out in the United States of America, and they have found out that teenagers who are more vulnerable to depression and anxiety, and these teenagers who are exposing themselves to social media for more than 12 hours a day, they are suffering from depression, anxiety, and they have got a poor mental health. By poor mental health, we mean that their frustration tolerance is decreasing, they have become intolerant, their productivity is being affected, they are more distractible, and their self-esteem is another factor which gets lowered because of so many hazards which this is producing. I mean, it is spreading a culture of intolerance, spreading a culture of external validation. Everybody wants puts up a selfie and then wants it to
People
be
to like
validated,
it and comment.
and these comments and the, everything, this gives a poor picture of yourself, and but you get an inflated ego, and you actually it is ultimately leading to a poor self-worth, low self-esteem.
It's a cycle, isn't it? That is,
it's a vicious cycle.
It's a vicious cycle. Okay, yes, that's very interesting what you said. Also, the sort of the breeding of discontent, because what you see a lot happening on social media is a display of an achievement, or maybe something you want to do or you have done, and then the sort of cycle of wanting people to appreciate what you're doing, and and then there's the comparison as well, because you've got all these things happening where other people are achieving something, or it might be something that it isn't exactly the way it's portrayed on social media. How dangerous is that?
This is a very important issue. The things which are being portrayed on the social media, they are not necessarily as how they are. They are fabricated. There is an element of manipulation. There is an element of incitement and deprivation. Things. The things are always manipulated, and sometimes a very brushed up picture is also given up.
Exactly.
And when you see a good picture, you start being envious, and you develop a sense of deprivation and low self-esteem. And when you see otherwise, then it affects your mental health in another way.
Right.
And it has got both the effects, and I think the negative effect is being dominated, because everybody is in a rat race, and there is no check, there is no watchdog.
The rat
and
race.
because the other media, there is always, if you read a newspaper, if you watch TV, there
a
are always
comparison going on.
moderators, and there are check and balances maintained. But here there is no check and balance. If there is the people have become so fond of it that if there's something fighting going on in a public place, or even in a classroom, or they will take a selfie and upload it,
or a video.
and the people will start commenting on it, giving all sorts of
So are we in danger of being desensitized then?
I don't get your question.
Are we in danger of being desensitized then, with
Yes.
all these different emotions?
And we are almost in a state of desensitization. We have started liking bad things and spreading bad things. There's no check. You get a message which is something not good, but you forward it, and then you spread a wave of anger, fear in the society, and the bad things are coming up, and we are, you are right, we are not we are not sensitive to cut it down, but we people are spreading it because they think this is in vogue, this is being liked, and
this is the current trend, this is what we should be doing. So Dr. Najma, what do you recommend for a person who is, you know, using social media, which are many people? How do we sort of, you know, filter information or the time that we spend?
This social media has become a second parent, or I would say a first parent.
The first parent, actually, you're right.
But even children, they start following the social media, and they become isolated, and they are more involved in this information, and they would not listen to you. You're calling them, but they're so immersed, and this leads to problems like social deprivation, and the children are not socially competent now. They are lagging behind in social development, but they are very far off in the cyber world.
Yeah.
And I think it is we must not forget our own values, and we must focus on our children. We can't shut them social media. We can't control the access. The access is there, and it is easily available. But you have to inculcate these things in your children and your teenagers, so that they understand what is right and what is wrong. And basic human values, character building, this must be emphasized at home and in the school and in the universities, because there is so much involvement in it that the productivity of the students at the school level, at the university level is affected. They become more distractible, and it is leading to other
mental health issues.
Studies have proved that depression and anxiety, low self-esteem, low frustration tolerance, these things are more common in the last decade because of excessive involvement in the social media. This is having an impact on the mental makeup of the children and the teenagers in a way that they think this is right.
That's true.
Their tolerance is decreasing. They would suddenly start fighting with each other, abusing. You know the language which is being used on the social media.
Definitely.
This is also
it has to be put in check. Yeah, absolutely, you're absolutely right. Dr. Najma, tell us about the impact of social media in relationships, especially in our part of the world, where there is a segregation among both sexes, and it's not in every environment that you'll be easily communicating with somebody who you want to. Now, how do we sort of keep this in check as well, to make sure that inappropriate relationships are not being formed, or somebody's not being exploited in some way or the other?
Yeah, I agree with you, because there is no discrimination between a girl and a boy, and everybody is focused on the social media, and they are learning from each other, and social networking has increased the intimacy between both sexes, and it has led to a lot of issues. You make when you are in touch with each other on social media only, you paint a different picture,
of course,
which is not in reality. And I have seen cases, young boys and girls coming to me, they have made up marital relationship because of this connectivity, and later on they had problems because they had a different image, and they were not able to cope up with what was there in reality. And this is one issue. And I think again I will suggest that upbringing at home and in the educational institutions, these proper attention should be given on character building of the children and on the teenagers, so that they should always be able to keep a distance between what is right and what is wrong, how far they should go forward, and where they should restrain. When there is no restraint, then mental health issues arise, and children land up in difficult situations, and suicide rate has increased because of these emotional issues.
Right, okay. Thank you very much, Dr. Najma, for joining us for our segment on emotional well-being. You've given a lot of expert advice. And, you know, the things that Dr. Najma said, they are so common. A person needs to be very vigilant. If you're a parent, you have young children, impressionable children who are using social media extensively, do take out the time to talk to them. Do take out the time to get some insight as to who they're interacting with, especially people who are at vulnerable ages, who are looking for a life partner or getting into a relationship. You must be able to sort of get them out of their isolation and make sure they're not in a relationship where anyone can be exploited. So that's our segment right now, the emotional well-being, and now we're going to go to our next segment, which is the medical breakthrough. Okay, and now we're on our final segment, which is the medical breakthrough, the latest research that we have in the field of medicine. We want to bring you this information as well so that you can know what's going on in the world of medicine. Now, let's think about, we know about printing paper and printing reports and things like that. What about printing new eyes? Well, replacing an eye after illness or accident is costly. A traditional glass or acrylic eye can cost about $5,000 and take hours to mold and hand paint as well. And these new eyes still may never look quite right. So we have a new technology, it's called 3D printing technology, that may change and bring down the cost of a prosthetic eye down to as low as $150. The new technology is also said to allow for precise color matching with the existing eye. A joint project between Britain's Manchester Metropolitan University and London's Fripp Design aims to have eyes ready for the market within a year. So that is something that is completely mind-blowing and very, very interesting, isn't it? We've come to the end of today's program, the end of today's episode. We've talked to you about the eyes, something that actually we do tend to look over, and we don't, take that much care as we should of our eyes, but they are working 24/7, unless we're asleep, of course. So I hope that you've learnt something from today's program. We've had experts in they've spoken to us extensively about things. Give us feedback. Join us on our Facebook page, Health is Wealth, and tell us what you thought about the program. Were there aspects that you thought that we should talk about further? Do you have any concerns? Interact with us. Tell us what you'd like us to talk about, and we will read your comments in our upcoming programs. So stay safe, stay healthy, and see you next week. Bye-bye.